Good afternoon, everyone. My name is Abdrazak. In today's video, we shall be talking about nephritic syndrome. In our overview, we would see that nephritic syndrome is characterized by acute renal failure, that is increased blood urea nitrogen, that's BUN, and creatinine combined with oliguria, and this is associated with hypertension and hematuria. Here in nephritic syndrome, edema and proteinuria are present, but are much less severe as compared to nephrotic syndrome. So these are some of the key distinguishing features between nephritic and nephrotic syndrome, in that in nephrotic syndrome we didn't see hematuria, but in nephritic syndrome we are seeing it happening. Here there is also hypertension. In our second slide, we shall be looking at the pathogenesis of nephritic syndrome. The main thing is that there is damage of the glomerulus, and here it is much more severe than in the nephrotic syndrome. In nephrotic syndrome, the damage allows leakage of proteins, but in nephritic syndrome, it allows leakage of even large molecules like large cells, like even red blood cells. So the immune complex deposition triggers proliferation of the glomerular cells, e.g. the epithelial, endothelial, and the mesangial cells of the glomerulus, and stimulates arrival of neutrophils. In this slide, we shall be looking at the clinical presentations of nephritic syndrome. For the signs and symptoms, we shall be having edema, oliguria, and hypertension. Hematuria is often described as smoky brown or color-colored urine. We should know this. We should know these features which try to distinguish between nephrotic and nephritic syndrome. In nephrotic, we didn't see hematuria. Hypertension wasn't that seen in nephrotic syndrome, and in nephritic syndrome, although we have edema and proteinuria, but they are less severe as compared to nephrotic syndrome. So as we continue, if patients have post-infectious glomerulonephritis, they will most likely have had symptoms of the precipitating illness, e.g. pharyngitis, skin rash. For the laboratory findings here in nephritic syndrome, we shall say hematuria, proteinuria, that is less than 3 grams per day, and elevated BUN and creatinine. For the lab findings, the continuation, when we look at the serum complement levels, we shall see low levels. They are found in acute post-infectious glomerulonephritis, membranal proliferative glomerulonephritis, SLE, bacterial endocarditis. And for the normal levels of the serum complement, we shall find it in IgA nephropathy, idiopathic, rapidly progressing glomerulonephritis, and glomerular basement membrane antibody disease. Furthermore, when we look at the causes of nephrotic syndrome, for the specific causes of nephrotic syndrome, there are 3 conditions that can cause nephritic syndrome. Of course, one being post-infectious glomerulonephritis, second being rapidly progressive glomerulonephritis, and the third being membranoproliferative glomerulonephritis. This table is trying to compare differences between nephrotic and nephritic syndrome in terms of proteinuria. In nephrotic syndrome, there is above 3.5 grams of proteins lost in a day, while in nephritic syndrome is less than 3 grams per day. When we talk in terms of edema, it is found both in nephrotic and nephritic, though it is much pronounced in nephrotic syndrome. When we talk in terms of oliguria, in nephrotic syndrome, we didn't see oliguria, but in nephritic, there is oliguria. Furthermore, going to hematuria, in nephrotic syndrome, we don't see hematuria, but in nephritic, hematuria is there. For the other features under nephrotic, there is hypoalbuminemia and hyperlipidemia, while on the side of nephritic syndrome, there is hypertension, red blood cell casts in urine, and elevated BUN. Thanks for listening. Don't forget to subscribe to my channel. My name is Abdrazak.